Hi, you guys. Welcome back for our daily practice questions. As always, I'd like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, Q banks, digital flashcards, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any other questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I teach on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 26-year-old female presents with a pruritic rash that started with a single large oval shaped lesion on her chest. Over the next few days, she developed a smaller oval lesion along the lines of her ribs, creating a Christmas tree pattern on her back. What is the most likely diagnosis? Is it A, tinea corporis, B, pityriasis rosea, C, psoriasis, or D, contact dermatitis? Take a moment and tell me what you got in the comments, you guys. All right, you guys. So, I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is being asked of you. So, here the stem of the question states, what is the most likely diagnosis? And y'all know what I always tell you. If they're asking for a diagnosis, you need to run it back and look at the assessment findings, right? And then three things that I always tell you to focus in on that introduction of those assessment findings is a patient's age, gender, and ethnicity, as this can help you to determine diagnosis and treatment. Okay, so this is a 26-year-old female. Her chief complaint is that she has this pruritic rash that started as a single large oval-shaped lesion on her chest, and then over the next few days, there was a smaller oval lesion along the lines of her ribs, creating a Christmas tree pattern rash on her back. Now, Brittany's brilliance. When I say this, you say that. So when I say Christmas tree pattern rash, you say pityriasis rosea, right? So B is your best answer. Now, I'm always looking for ways for y'all to think of things and retain things. So when I was thinking of what I was going to do during the holidays, I had to do a spin off of Christmas with the Christmas tree pattern rash. That is just my craziness. But always remember Christmas tree pattern rash is pityriasis rosea, okay? Question number two, a 32-year-old male presents with a rash that started on his chest and spread to his back in a pattern resembling a Christmas tree. The patient reports mild itching but no fever or systemic symptoms. His physical exam reveals a single large erythematous scaly lesion followed by a smaller oval lesion with a fine scale along his back. What is the most appropriate treatment for this patient? Is it a topical antifungal therapy, B, systemic steroids, C, symptomatic management as it resolves on its own, or D, oral antibiotics? Take a moment and tell me what you got. All right, so stem of the question here states, what is the most appropriate treatment for this patient? So y'all know, I tell you, if you're looking for a treatment, you need to run it back and determine if they provided you with a diagnosis. If the diagnosis has not been provided in the question, you need to run it back a step further, look at those assessment findings so that you're able to determine a diagnosis or a differential so you know how to treat. Because you got to know what it is to be able to provide any treatment options, right? So here, the diagnosis has not been provided. So we're looking at these assessment findings. We have this 32-year-old male came in with a rash, started on his chest, has spread to his back, and is resembling a Christmas tree. Again, Merry Christmas. But it's pityriasis rosea, right? So I want you to think of how do we treat pityriasis rosea. Pityriasis rosea, we simply use symptomatic management like antihistamines and topical corticosteroids just to relieve that itchiness and the inflammation um, to those locations and the scaly lesions that you may find. but it is known to resolve on its own. So C is your best answer. All right. Lastly, question number 3. A 45-year-old woman with a history of seasonal allergies presents with a rash on her trunk that began as a single large scaly patch and later developed into smaller oval lesions along the lines of her ribs. The lesions are pink and mildly itchy. She denies systemic symptoms such as fever or malaise. What is the most likely diagnosis and how should it be managed? Is it A, actinic keratosis and treat with oral fluconazole? B, pityriasis rosea, reassure the patient that this will resolve on its own. C, atopic dermatitis, treat with emollients and antihistamines. Or D, herpes zoster, treat with antiviral medications. Take a moment and tell me what you got in the comments, you guys. All right, so stem of the question here states, what is the most likely diagnosis and how should it be managed? So again, when they're asking for a diagnosis, we're looking at these assessment findings, right? So this is a 45-year-old woman. She has a history of seasonal allergies, and she's come in. She has this rash on her trunk. It began as a single large scaly patch and later developed into smaller oval lesions along the lines of her ribs. Now, y'all, also, we know that the Christmas tree pattern rash is classic presentation for pityriasis rosea. We know Herald patches are classic, but even when they are describing these things as how they present, again, I always tell you with derm, think location, location, location. The trunk is the key location here. Also letting you know that there are little scaly patches and they're oval shape. This is also classic presentation for Herald patches and pityriasis rosea, and going along the lines of her ribs. This is all presentation for B, pityriasis rosea. And of course, again, we want to reassure them that this is something that resolves on its own. All right, you guys, I just wanted to give you a few scenarios on the presentations of PR, how it may be worded differently, taking those key terms that you know, and then just giving you the description so that you're able to identify it in that fashion. And then, of course, the treatment. Again, I did it off of a spin of just it being Christmas, and the Christmas tree pattern rash stood out to me. So, anyways, Merry Christmas, you guys. I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. If you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number 1 at gmail.com. The things that I do offer are all linked in the bio of this channel, to include my question bank, my digital flashcards, my review book. You can get it in a paperback or you can get it in an ebook. Are all linked, like I said, in the bio of this channel or on my website. And then all of my one-on-one sessions or customized plans. I always say reach out either by calling, texting, or email, as I like to speak with you to gauge what you truly need to make sure you're booking the appropriate session types. My one-on-one and customized plans are structured. The foundation is similar, but it is customized based off of your needs. So we always start with an initial assessment, being a pretest. If it warrants a little bit more deeper assessment, we will do standard systemized detailed questions just to gauge where you are completely through all 16 systems. And then based off of that feedback, I will set up a plan and map things out with you. And then we determine what is the best route for you based upon those findings and those gaps. And based off of that plan, then we start the teaching. So I provide you with resources and tools so that you are making those gaps that I have identified from a weakness to a strength, and we work through those and progress through those, and then we go to the application phase where we're doing question analysis and making sure that you are knowing how to take that knowledge that we have now strengthened and applying it to questions, and then ending with a exam readiness to make sure that you're prepared to succeed on board. So that's why I prefer speaking and doing a consultation with you guys initially before booking, so that we can make sure that you are on the right path of what is going to be best for where you are in this process and what you need. Okay. But again, as always, y'all know what to do. Make sure y'all meet me back here. Happy studying. Merry Christmas. And y'all make sure y'all meet back here. Happy studying. Bye, y'all.